Motorcyclist speaking.
Stabbing's landed.
Ready, steady, slide.
He was stabbed on the left side of his chest, going into cardiac arrest.
So this is a really significant chest injury, especially his age, puts him at a really very high risk of mortality.
Now you have an aneurysm, right? There are risks with this procedure. If something goes wrong, the patient may not survive. There's no second chance.
Breathe in and hold your breath. Breathe normally.
Hello, Royal Stroke Recess.
Can the heart block go back directly to the cardiology?
Okay, Aneurysm stages. Okay.
Just need to review this trauma chap, get some blood off him.
Any obvious injuries?
Left femur fracture.
So there's a road traffic accident over in Wales.
He's got pain in the right groin, an open fracture.
Just about to put the call out. What's ETA?
10 minutes. Thanks, bye.
Has she got a line in?
I'm popping a line in now.
Do you know what the outcome of the conversation was about the stabbing that's on the way? He's a stabbing in the chest. He's had a thoracotomy in ED. Right, OK, sorry. Are we on? OK, stabbing's landed. If anything else comes, then keep the space, just in case.
It's very difficult to estimate how big a knife was and how deep it went. And they can look like very little wounds, and actually then they go straight into the heart and can kill you.
Right, you happy to transfer over first, then?
Everyone ready? Yeah. Ready, steady, slide.
Is there anyone that can do an ECG for us? Yeah, we're just a bit short on nurses. Right, go for it, yeah.
Hand over. Okay, so this is Lewis, 18 years of age. He was stabbed on the left side of his chest with a 20-centimetre kitchen knife. In rectum malar, he deteriorated in the emergency department, ultimately going into cardiac arrest. He had a left lateral thoracotomy performed in the emergency department, which resulted in a ROSC. In theatre, they opened his pericardium and they identified a laceration on his left ventricle, which they stitched. He's a foster kid. His foster mum and his foster dad have all been informed.
Great. OK.
I've got to go because the aircraft needs to move to make way for the next aircraft that's coming to bring in the next patients.
Thank you. OK, primary survey, if we can get the infusions transferred over and all the monitoring transferred over. What drains has he got in? So one each side? Two on the left side, and they're both OK?
They're both
swinging. OK, yeah, thank you. Not much blood in them or anything.
Lewis has had a thoracotomy. They've opened the chest wall and then they squeeze the heart manually with their hands in order to pump the blood round. Most people with a direct injury to the heart would just die instantly.
Have you seen his pupils, Flip? So the worry is obviously had intervention into the injury to his chest quite quickly, whilst he was extremely whilst he was in cardiac arrest, essentially. So there could be injuries that are still bleeding.
He was transferred to us because if he suffers any complications or he has further bleeding or we need to operate on him again, then we've got cardiac surgeons and thoracic surgeons on site here. He's the sort of patient that if he deteriorates, it will happen quickly.
If we sort the monitoring.
Oh, he's on some NORAD.
Yeah, can you make up some noradrenaline for us?
We have got some adrenaline drawn up.
It's going to be the infusion. Obviously, if he starts to bleed again, we'll see his blood pressure drop and his heart rate increase to compensate for that. So that's just one of the things we're looking out for at the moment.
Perfect. So we'll need some new bloods off, and we may as well do a gas. I presume he's got an A line in. So are you happy to take the bloods off there for me? That'd be really helpful. And then there's something else cooking off in Bangor. Another trauma patient coming. Any minute now.
Should we just do a 12-lead ECG roll?
Yeah, we'll do. And any patient that's been through a period of cardiac arrest, we worry about the possibility of long-term hypoxic brain injury, which can be devastating, really. And it only takes 3-4 minutes and you could potentially have permanent damage.
We don't know somebody's brain function until we start to reduce the sedation and we see whether they wake up.
Ducky, bring him through and I'll ring sister and we'll sort it.
As soon as the phone rings, I'm going, what if that's another patient? I'm short on space, I'm going to need this, I'm going to need another doctor.
That lady will maybe sit down and we can have
the heart block. They'll just do a direct swap.
Obviously, the sickest patient comes first.
We've got an 87-year-old patient who has been headbutted by a cow. Yeah, cat too. He's got concerning injuries to the chest.
Any patient over 80 or so, we'd be really worried about their chance of survival, particularly if they've got major injuries.
Hiya.
Able to hand over.
Yeah, that'd be great. Thank you very much.
1, 2, 3. This is Eric, he's 87 years of age. He's working at his own farm and he's been knocked over by the cow. And so injuries-wise, he's got difficulty breathing, he's got diminished air entry right side.
Okay.
He's also got what looks to be a left-sided shoulder dislocation. He's had 7.5 milligrams of morphine.
Very much.
Okay.
Primary survey, monitoring and chest x-ray.
My name's Robert, I'm one of the doctors. Just going to have an examine you, okay? Okay.
Is this arm painful?
A bit further up, somewhere on the top, I think.
And then this is your...
Very tangled.
No, it's the right side of painful.
That's from the cannula, so this is the side with the...
But it's more posterior chest wall.
What did you do to upset this cow?
I don't know. She's such a quiet cow. I wasn't careful enough. I thought I could trust her, but she knocked me with the head.
Okay. Do you need any more pain relief?
Well, I wouldn't mind a bit.
A little bit?
Yeah.
Would that be nice? Can I have a large fentanyl?
Yeah.
Even though somebody seems to be quite well and quite comfortable, it can be quite deceptive how bad the injuries are underneath.
Can you get some blood off for us?
So there's the initial risk of chest injuries. Those things can be life-threatening in the first minutes to hours of an injury.
Let's have a listen to your chest.
Air entry?
Present, it is reduced. It's got subcutaneous emphysema.
Has he? Yep, we definitely need the x-ray. He's got subcutaneous emphysema on the right side. Are you all right for a couple of minutes to do an x-ray or not?
Yes, carry on.
Well done.
Right. Just keep that in the pocket.
Lovely, thank you. So on his chest x-ray, the left side of his chest is obviously deformed with visible air that's leaked out of the chest cavity into the skin and under soft tissue, and you can feel it when you press down. I expect he may well need a chest drain. We're going to go now for a CT scan, just to get a bit more information about your chest injury. Yeah. OK, should be good to go, because we're on the clock. Go, go, go. This is a really significant chest injury, especially with somebody of this age. And he's got a serious risk of complications, which are potentially life-threatening. Sally, we had to move her out because we've got more trauma coming. How many's outside now? Two. I'll go sort out that other guy. He's in scan at the moment. Brilliant. He was in one, he was in scan, he'll go to two, and he needs a right-sided chest drain. Rob's going to take this one, and then we'll use this cubicle for the chest drain. We'll just put him next to the bed, and then when we're sure he's not going off anywhere, we'll move him over. It looks like, do you remember we talked about this tube we might have to have?
Yeah.
It looks like we're probably going to need to do that. What we do is we make a little hole in the skin and then insert a tube and literally just drain the air and any blood out into a bottle, OK? Is your pain any better? Do you need a bit more?
Well, I could do with a bit more.
A bit more.
All
right then,
Eric.
Yeah.
Okay.
Just make that all the way through, that there.
Is it?
If you feel with your finger, you'll feel what I mean. Yeah, that's it, yeah. And then it probably is enough. That pleural lining is really quite tough, and there's no real way round it but to sort of puncture it quite firmly. Oh, there you go, that's it. And that's the bit that's agony. Sorry, Eric.
Oh, dear.
OK, it's coming. More drugs coming in, OK. Sorry, that's the nasty bit.
Oh, boy.
I'm just stitching it in now, so you might feel a bit of tugging.
I don't feel all that well. A bit sick.
Take a nice deep breath in. When that's not bubbling anymore, then you consider taking it out. Yeah, so we're going to have a look at the scans. Did IR ring back?
Radiology have just run. They said a moderate pneumothorax with hemothorax, extensive lung contusion, and it's a subcapsular hematoma on the liver with evidence of active bleeding.
They say that it's quite sizable.
Hi, it's Julie Norton. Just to let you know, there's evidence of active bleeding from his liver on his scan. OK, if it comes from an artery, it's more likely to need intervention. You should have a look. OK, thank you, bye. Can you hear me all right?
Yes.
There is some bleeding coming from an artery in the liver, but definitely it's getting a bit more increased. And they can see the dye that we've injected, they can see it coming out of an artery. So they want to have a little look to see if they can stop that bleeding. I'm going to do it probably in an hour or so.
Yeah.
All right, once we get everyone together. Is there anyone that you want us to call?
You only upset them in the middle of the night. So, you know,
You sure?
No, I don't bother them.
All right, thank you. Oh, you're so lovely. Every time I go here, I say, so lovely. Neuro exam.
I think if you make a connection with someone, then that's always really powerful. That can make it harder if they do badly.
So he's going to go to interventional radiology. They're going to have a look to see if they can embolise the artery that they can see is bleeding. The issue is after that, he needs to be somewhere where we can keep a close eye on him and be able to intervene should something go wrong. But with that age, that chest injury, a liver injury on top of that, he has got a significant mortality risk. And he may well deteriorate. And there would be some very difficult decision-making to be done if he got to the stage of having to need ventilation or lung support, because it's unusual that people of that age with those sort of level of injuries do well if they get that bad. So the next few days will be really important.
Got a standby. I'll be here in 5 minutes. It's an 81-year-old tracking patient. Okay. Known COPD, widespread congestion.
I've been his foster mum for 12 years, and I was away in London, and my daughter called me, his sister, to tell me that he'd been attacked and stabbed. So that's how I first heard. Yeah, incredibly terrifying, and being so far away, but also just, unimaginable. He's grown into an amazing young man, and he never gets into any, trouble, anything like that. He works and he goes to college, and he's a really good lad. They've been amazing, they've saved his life, and now he's come here and he is in the best hands. However, it's still really touch and go.
Call the helicopter.
Hello, resource. Stepping this chap down, aren't you? He's going to pressure you. I'll ring her up and safety net her then.
Okay, what's the heart rate?
It's just been one of those days, when we've had quite a lot going on at once, so.
How long are you going to be home?
Yeah. The query stroke, the stroke team are coming down.
Yep, I'll pass you on to his
We have Mrs. Gilroy. She is 65. She has an aneurysm at the back of her head, what we call as a basilar artery. This artery is vital for life. It's life-threatening if it ruptures. If they rupture, 40% of them won't survive, and 50% of those patients who survive remain permanently disabled. So this has to be treated quickly. Vivian, hi. Dr. Nayak. Now you have an aneurysm, right? So when we say an aneurysm, it's nothing but a bulge on a vessel wall. It can slowly grow and grow. At one stage, it's like a balloon. We put more and more air, so one day it just goes. So at that time, it's life-threatening. Now, once you close the aneurysm, what happens? It blocks it off permanently. Have you been going to work or you've been taking time
I've still
off?
been going to work.
Still going to work?
Yeah, to try and save jobs with COVID.
Yeah.
So it's been difficult.
Yeah. How's it affected your work since?
Oh, horrendous. It's like you're walking on eggshells. You're sort of afraid, if I take too much stress, is it going to erupt? It's been difficult.
I have to tell you there are risks. As a patient, you should know this.
Yeah.
Okay, so I'll be in touch after the procedure. I'll speak to you as well. She's going to probably go to recovery first.
Yes.
And from there, she'll be brought to the ward up here.
Yeah.
When I got into hospital, they thought at first I was having a stroke and took me for a scan. We found an aneurysm. I was in total shock and upset. And that's really how they diagnosed it.
It's always there in your head, you know, what else can I do to help? Will the aneurysm burst? Will the operation be okay? Because you always start to think of the worst, not the best. The best is she'll be out of hospital and we'll be able to go running through the fields together. But you know, that was the worst. Is there something going to happen during the op? And there's always a threat there or something that could go wrong.
You think you're bomb-proof really, and you're not.
Okay, so today we have Vivian. She is 65. She has a basilar tip aneurysm. We are going to use most likely the web device. So this is what it is like. You know, we're going to place this into the aneurysm and occlude the aneurysm. We'll monitor during the process the blood pressure and everything else remains stable. Yeah. Any questions? Because at this location, if something goes wrong, you know, the patient may not survive. There's no second chance.
Hello, resource senior staff news.
He's now got a large swelling over the left side of his neck. He's complaining of a severe headache. 10 minutes.
Thank you.
Okay. Right, 21-year-old male's been reversed over by a van. He's got a blood pressure of 82 systolic. He'll be here in 10 minutes. All right? Yeah. You see that one, I'll sort this. Okay. I've got a trauma coming in. Tash, can we move once the neurosurgeon's finished, move number 5 round to red recess for me, please? I've got a 21-year-old that's been run over by a highway maintenance van. It's reversed over him. So we'll see. But we're a bit stretched thin at the minute because we've got sick patients everywhere. Have you got... Oh no, I need to move 5.
I'm waiting for 4.
Fab.
What's his name? Right. Has he been seen?
But he's got very low blood pressure, so we think he might have broken his pelvis. So we'll see what he's like when he gets here, but when the patient arrives, don't put them on monitoring until we've taken handover. Just everyone wait, and then when I say, we'll do it. All right. I think he's here. Hello. Are we now stable for transfer? Would you mind just ringing X-ray? Just to get them in for me, just because we'll do a pelvis shoot through. So what we'll do, team, we'll transfer over, move the trolley out, do handover, and then get on the... Get on everything.
On through then. 1, 2, 3.
Okay, who's handing over?
So we've got Joseph Plant, he's 21. He's been cutting the grass and a large lorry, one of the large highway maintenance lorries, has reversed into him.
Yeah.
He thinks his left leg has gone under the wheel.
Yeah.
Top to toe, he's complaining of right groin pain, where the bandage is on his left foot, suspected open fracture. Treatment-wise, he's been on the Entonox. He's had 1 gram of IV paracetamol.
Yeah.
He's had 2.5 milligrams of morphine.
Any questions? Right. Monitoring on, let's start the primary work at the top. We have to get off.
Any pain in the back of your neck, Joe?
No.
Right, so airway we're fine with.
You can have a feel of your tummy, Joe, okay? Just put your arms down by your side.
Let's get the blanket off and see what we're doing, Sarah. So just pull it down a bit. Let's see what we're dealing with, okay?
Any pain down here at all, my love? Okay, just relax for me. Any pain here?
So just gently palpate the femurs and just see if they're swollen or tense.
Any pain here at all, darling? Yeah.
Give them a good grip. There we go.
Any pain there? Yeah. Yeah. So his right femur is tender.
Right femur's tender, okay.
It's, no neurovascular involvement.
Okay, we'll just have a quick look at his pelvis and then we'll might help us manage things, all right? Just get in there, get the scan. Okay. X-ray coming in over your heads, guys. Everyone wearing lead?
Yes.
Yeah. So we're just going to do an X-ray of your pelvis, okay? Just stay nice and still.
Let's have a look at this then. He hasn't broken his pelvis. It's a subcapital neck of femur fracture.
So that's broken, yeah.
That's right neck of femur fracture.
Put your legs to your heart. Just relax, my love.
That foot's
It's
very
okay.
floppy. His foot's completely mullered, I think. He split it laterally, but the abrasion's on top, so I think he's just squished his foot. It's quite floppy. We'll get that x-rayed, but also often need to go to theatre if it's bad, because it's going to be, the wheel's gone right over it.
Right scale. Accept call.
Yes. In A&E, we're a lot more flexible at the minute. So, given you're a scared mum, I'm happy for you to pop up. Well, I know you will, because you're a mum. All right, no worries, cheers. Bye, bye.
Is that your mum on the phone, Joe?
Mum's on her way. All right.
I'll send you around for an x-ray now. All right, my love.
Joe said just need to put this on because she's going to X-ray. It won't be long, Joe says, till the X-ray thing.
Okay, so we'll do about 2 weeks on your foot, 2 of your ankle, we'll do 1 more of your hip, then we're done, okay?
Yeah.
You need to get the leg from a different angle, okay? Sorry.
I don't know if it's working in some pain relief if you can, if he's not had some already.
He's had pain relief, I just gave me.
But if you can't move that leg, I can't do a lateral for you.
Do you want me to have a quick gander? Yeah, okay.
Breathe normally.
You know what? They can work with that. Yeah, ain't doing much in touch pain. Right, hold on.
There you go, well done.
All finished, okay?
Any update on the chappie in 6? How's he doing? So Joe's had the lorry go over his legs. So we've x-rayed his pelvis and both ankles. And on this side, he's broken the hip. Oh yeah, he's broken it across there. His left ankle, he has got a little fracture just away from the ankle, but he's also broken a couple of bones in his foot, and one of those has got a decent wound over it, so he's going to need to go to theatre. And this is his right ankle, and you can see it's sort of broken up here. It's twisted and split. And then on his foot, you can just see there's a break in there. Quite a few little breaks around, but, you know, given the fact he's had a lorry run over him, he's done all right. Right, let's go and tell him. Hello, you're right. Is it Amanda? Yeah, my name's Chris. I spoke to you earlier. You're right. We've got all your x-rays back now, Joe. All right? Because that left side, because of where you've broken it and there's a wound on the outside, it's what we call an open fracture. And so there's an opportunity for bugs to get in. And we don't like bugs getting into broken bones. And so that needs a washout and just needs that treatment. But I think because it's an open fracture, this is something they treat urgently, so it'll probably be happening tonight. All right, so we just hold tight until there's a gap on the theatre list and then get you down. Okay, we'll leave you to it. Cool, no worries. Catch you later. That one, no, but the other, no.
Are you busy in there? Do you want to just...
I need the waterproofness of them, mate.
It's 7:30 in the morning. I'd gone back into the ICU and they told me there and then they were about to wake him up. It was really frightening because of obviously all the tubes. He was quite distressed, obviously, when you wake up from a general anaesthetic or a sedation. You don't know where you are, but it was nice. He recognised me straight away and sort of grabbed for my face, and it was a good feeling that he did actually recognise me. So
it's great, honestly. I woke up this morning in pain, feeling a little bit sore, but now I'm feeling okay, just a bit tired. I remember, like, it, honestly being stabbed, it was like, it wasn't felt like you being stabbed. It was like a a little tap. It didn't feel like any pain, no. Probably because the adrenaline going through. I remember seeing the blood, and then, yeah, pitch black after that. I remember waking up while the ambulance people were there. And they were holding me down. I basically was telling them, trying to tell them to get off me because it was hurting me. And then, yeah, I blacked out again after that. I don't see the point in using knives in general. There's no point in them.
He's done miraculously. And he's already out of the ICU on a cardiac ward with a lot of the assistance he needed removed. And yeah, he's doing great. Just to see him eating and drinking is unreal, and being able to get out of bed now and take a few steps. So that is wonderful.
We're in this environment every day.
His scan's all right, so I'm going to clear his neck now.
And it can be a bit chaotic. The pressure, the noise, the people.
We can go and come back and then we'll do the drain.
So it's really important that we're able to take in all the information available to us in order to make each decision, minute after minute after minute.
Coming through, excuse me.
Hello, resource.
Come in. We'll see what we need to do.
All right, what's your ETA? Okay, I'll let them know. All right. Cheers, bye. They should be here in exactly 2 minutes. 47-year-old motorcyclist, rear-ended, thrown significantly off his bike.
Do you want me to take this or?
Can do, if you're happy.
Yeah.
And I'll step down.
Primary survey, please. Early X-ray, if we can, please.
And it's Claire and one of the doctors.
Are we able to get them off the scoop at the same time?
Full movement at the left side of the chest.
The top pupils equally active size 3.
Trachea central.
Okay, Joe's side of the scoop, are we free?
Yeah.
You happy with the chest, Claire?
So it's got decreased movement on the expansion on the left side, decreased air entry at the left base.
Right, other side out. X-ray in. If you need to stay, can you put a lead on? If not, can you move out?
Yeah.
Will you get another access and some bloods off for me as soon as we've shot this X-ray?
When patients first arrive, we're looking for clinical clues that we can kind of try and target our treatment, but we don't really know what's going on inside. We've got to try and find that out. So as the TTL or the consultant in charge, you need to be watching everybody else and taking it all in and then directing what people do. It's about maintaining situational awareness as much as being in charge.
The left side of his chest isn't moving, so we're worried that there might be blood in the chest. Okay, Zane, can you get IV access and bloods off? Will you order the scan for me and speak to radiology? Yeah. And then we'll get some more information from that.
She's going to take your temperature, little thing in your ear.
Thanks, Claire.
How bad's the pain at the moment out of 10?
Oh. We've just given you a bit more. If you need anything more, just let us know.
Hi, I'm Julie. I'm one of the consultants looking after you, OK? We're going to go and get this scan and we'll get some more information about what's going on there, OK? So the main concern is his chest. He's got a lot of pain on the left side of his chest, and when Claire's had a listen, he's not moving so much air on that side. There's clearly a concerning problem with his lungs, and all lung injuries tend to get worse before they get better. There's also a possibility of a head injury, as he's a bit confused and repetitive, so that's our other concern, really.
Motorcyclists are very vulnerable to injury because they don't have the protection of a car, so they often sustain more serious injuries. Thoracic spine injuries in particular, we'd be worried about damage to the spinal cord, and if the spinal cord was damaged permanently at that level, then there is potential to be paralysed from the waist down.
Ready, steady, slide. Just a bit concerned about your chest at the moment, so we're going to get a scan. Just going to look at you from your head to your pelvis, okay, and see what's going on.
Okay, so fine to come off.
Great, thank you.
Lumbar spine fractures, left-sided rib fractures, bit of maybe left basal contusion.
Okay, great.
Nothing, no hemoperitoneuria or anything.
Thank you very much. We just need to determine whether he needs any further intervention. Hi. Hi, are you with Andy?
It's always very difficult breaking bad news, but it's really important to empathise with patients and their relatives so that they can understand what's happening and make it a little bit less daunting for them.
He's got broken ribs on the left, the 5th, 6th, 7th and 8th, so 4 broken ribs on the left. And he's got some bruising to the lung tissue. And the other injuries he's got of his spine, he's got a lumbar spine fracture and a thoracic spine fracture, so 2 of them. Obviously with any spinal fracture, that's what we worry about, is any damage to any nerves, which can then affect walking, etc.
Is it a shock when you look at him?
He's still got these blocks on his head and he's got sort of drips and monitoring. He does need oxygen and even, worst case scenario, help with breathing, like a ventilator. Likelihood now is he'll go to the specialised trauma ward to be observed. So he's going to be in for a little while. So you'd expect, you know, a little bit of a bumpy ride. And like I say, we do expect people to get a bit worse before they start getting better.
This aneurysm is quite a significant sized aneurysm, and the size and the location makes it important that we treat it soon to prevent it from rupturing.
You got this. Yeah. Think happy thoughts. Think, where am I going to go on my next holiday?
Lake Garden, more or less, every year.
I think that's definitely where you should be
Yeah.
recovering.
That's what he said.
Yeah. Gives you something to look forward to, though.
Yeah.
Well, when you are in a patient's brain, you can't be having shaky hands when you're dealing with 2 or 3 millimeters of aneurysms. The margin of error, it's 0. Okay, let's connect. Yeah, give that to me. So we are doing what we call as a planning angiogram now. We're going to do a dye injection into the brain to see what the aneurysm looks like, and it's going to do a 3D construction of that aneurysm. And based on that, we will plan what is the right modality of treatment for. If things go wrong, if there's a bleed at this location, it can be life-threatening. Okay, let's do a spin. There's the aneurysm. So look at this. This is the real-time contrast run. Now look at this. Can you see this blob here? So that's the aneurysm. So now if you measure it, and on the lateral, I would say, so that's 7.5.
7.5 makes it a 9/5.
Yeah, we'll go with that. We'll try 9/5. So we're trying to make sure everything is perfect. We'll start now. So this is the catheter we're going to take on the artery in the neck, the vertebral artery, which is the artery which goes to the back of the brain. We have to be getting it, precisely within the aneurysm. Can I have a flow switch at the end of it, please? A flow switch.
Quickly, can I cover your flow switch, please?
Okay, X-rays on. Can we get the X-rays on, please? Townsend lateral. Yes, please. One more mag up, please.
Okay, one mag up.
See, there's the aneurysm, as you can see. See there, stop. That's the aneurysm there, and that's the one we're going to treat. You get the heparin?
Yes, heparin's in.
Good, thank you. Okay, let's do this. So I'm taking my catheter into the vertebral artery. You can see this is the wire, and catheter is going up.
We've got a while to go yet, Sandy.
Yeah, I know. You can push gently when I tell you. So now what we are doing is we are taking the device into the aneurysm through the catheter. Yeah. Keep pushing, yeah. It should go. Nearly there? This time, okay? When I tell you, 1 second, Marty. Can push now. Going all the way. There, it's coming.
Yep, there it is. There's a distal rhesus marker.
So it's coming there. See? push a little bit out, isn't it?
Bring the web back a little bit as well. Nice and slowly, nice and slowly. A little bit, but that's...
It's bigger, isn't it?
It is much, it's too big.
It's too big, isn't it? I think this is not going anywhere.
We have to withdraw this.
Nine is too big, yeah.
The height is too big.
Yeah, 8 by 4 or something.
8 by 4.
Yeah? I thought 8 by 4. So now, like everything else in life, this has thrown us a surprise. So we're doing something different now, but we are prepared for it. Taking the size, this one out.
8 by 4.
Yeah. Okay, let's deploy it this time. This one looks perfect.
Yeah.
Yeah? Yeah. So run and see. Yeah, that's nicely set, isn't it?
Mm.
I think it's, yeah?
Yeah.
Just trying to look there, just trying to push it a little bit. This is much better, isn't it?
Much better. I wasn't too keen on...
Yeah, perfect.
100, that is 100, much
Perfect,
better now.
Catheter is down there. Is it moving? Just take a little bit of tension off as well. Yeah, the tension is off. Take the wire out here.
Yes. Yep.
Okay, you're done. The positioning is very good.
Yeah.
Can detach now, isn't it?
Yes.
Yeah, look, it looks like it's good. So we can detach, right? So they've taken a bit of tension off.
You are happy to detach?
Yeah, shall we? Can I have the detachment, please? Yeah, all good. We have detached it. It's looking good. It's completely conformed to the shape of the aneurysm. So that's a good result. Okay? So we all done? Good, thank you.
I'll take that off for you.
It's quite a successful deployment, and we have managed to achieve stasis and signs of early occlusion. Now I'll show you what we've done. So this was that aneurysm here. See there. So this is the normal vessels. This is the device. Can you see this is nicely taking the neck? It's filling the aneurysm completely opened up like an umbrella into the aneurysm and conforming to the shape of the aneurysm here. And eventually I'll show you as we go through the runs. You can already see the aneurysm disappearing there. So this is a very good sign. You can see the disruption of flow within the aneurysm. So in coming weeks, this whole aneurysm is completely going to shut down.
When is the next one coming? I don't know.
Pull the helicopter.
Hello, resource.
So, got a second IV access, got bloods up, we run a quick VBG and stuff.
Water please, 2 green resource, thank you.
Andy, the motorcyclist that came in earlier on, I said to his wife really that there's going to be some bumps along the way. His chest is likely to get worse before it gets better. He's at risk of getting infections in his chest, particularly with having a spinal injury. He's going to lie flat on his back. He's been seen by the spinal surgeons and he's had an MRI scan. We're just waiting for the results for those to determine whether he needs any further interventions.
It was like watching a film that I was in. I was like getting launched backwards over this car, and then the next. I remember the paramedic, the air ambulance people were working on me. I don't know about back then. I got all my race levels on.
Yeah.
I got all proper spine protector and everything.
Yeah, well that's what saved you.
I'm smashed to pieces basically. Luckily, you can't do anything about it. So I mean, they're wonderful hands, I know. I mean, they know what they're doing, don't they?
Running around.
At least it's over now. It's just getting better now.
Mrs. Gilroy, how are you?
I'm fine.
I didn't think I'd feel this good.
You didn't think so?
No.
Why did you say that? I thought I told you you'll feel good.
I know, I should have listened.
Yeah.
The last time you saw me, I was
Yeah.
like really nervous.
Yeah. All okay?
Yeah, I've had no painkillers.
Nothing.
Nothing.
The treatment that is gone just as we planned.
I was amazed. I couldn't ask for more. You should be very proud of what you achieve. I am. When can I resume some sort of normality of exercise?
Yes, you can do everything which you did before, and more if you want. You can do whatever you wish. Anyway, nice to see you.
Thank you.
And take care of yourself.
Yeah, thank you for everything.
Thank you.
Thank you.
I think she's doing very well. She's just had an operation less than 24 hours ago, and she's, I think, made a very good recovery. She's going to go home probably today, and I'm very pleased with how she has recovered.
Can you hear me now? I said I need a handsome man with a limousine to come and pick me up. Do you know of anybody? I'm fine, so yeah, you can come whenever you're ready. I've just got to get changed and ready to go home. Okay, love you. Okay, bye bye. It served a purpose of telling me how fragile life can be sometimes, to make changes. So it's been a lesson to me and the family. I haven't got that worry. I've now realised that, yeah, there's other things, and spend a lot of time on, instead of stressing totally about work and COVID, hopefully is on the mend now. But do the things you've wanted to do. I might even have a saxophone and play saxophone, or learn how to play a saxophone, which has been one of my wishes as well.
Hi, how are you doing?
I'm getting better every day.
What we did was we fixed your chest, if you like, by putting metal bars and screws in.
Yeah.
So you got 6 bars at the back of your chest and 3 more in the front of your chest. You got 9 metal bars and screws in there. Yeah. And look at you, you're sitting in a chair, you're ready to go home now.
Is that okay?
Yes, thank you very much.
And no more farming for you?
No more farming, just do a
That's
bit of gardening after.
I don't blame you.
Okay.
Okay?
Thank you very much
All
for
right,
everything
you.
you did.
Take care.
Take care.
Bye-bye.
Bye-bye.
Bye.
Well, I'm looking forward to going home, but I'll have to stop looking after the cattle.
The most rewarding thing is when somebody comes in unwell or injured and you treat them and they get better. I think that's what we all want.
It fixed me back. I mean, it's the least of my worries, really. I've just got to deal with getting fit again for my family, just get well for my family.
Hello Amy, Resource County speaking, how can I help? Primary survey, access bloods, that's you, is that okay?
Yeah, that's fine.
We all undergo stress while we're dealing with some of these cases.
We'll have a little look what's under here then, okay? There's some blood stuff in there. He's got access already, hasn't he?
Sometimes you're feeling it underneath, but you just can't show it or express it or let it change what you're doing. Panic is the enemy.
Last little bit, sorry, really stingy.
Hello, Stoke Resource Choir speaking.
So he's all done. Is someone around to just tidy him up a little bit?
Cheers, bye.
Yeah, he's good to come. 21-year-old motorcyclist, no leathers, no helmet, has travelled at high speed and he's gone over the handlebars. We're going to take the trauma into one, Mark.